So we just got a phone call to review Mrs. Lung's vent and do a vent check. So first thing we're gonna do is look in the computer to make sure there's a doctor's order. And there's the order. So let's go see her. Knock, knock, knock. Hi, Mrs. Lung. I'm Mike with Respiratory. I'm here to do a vent check on you. I'm gonna wash my hands. Put gloves on. Ooh. And as I'm standing over here, I can observe her monitor, considering she's on a vent. She's in the ICU. You can also see that the bed's tilted 30 degrees. There's an ambu bag above the head, and there's a syringe and a mask on the back of her vent. Now I'm going to go get 2 patient identifiers. I'm going to check her wristband and the date of birth on it. Righty. Her vital signs. Checked her bracelet. It is Mrs. Lung. The ventilator. I can see it's humidified. See the patient is breathing. See what they're doing up there. Their capnography looks fine. See what the vent settings are. But I'm gonna assess the patients first. Make sure there's no water in the tube. And then I'm going to you can see the balloon. Going to assess the patient's respiratory sounds. Everything sounds clear. If not, I would suction them. I have a suction here. I can see that there is a mask and syringe up here, along with an ambu bag. While I'm listening to the breath sounds, I can tell that the ET tube is secured at the 24 at the lip with a Hollister, and I can check my pressure cuffer on here, and that looks good. And now to the actual vent. The humidity is a little low. It should be about 36 to 37. But I'm going to go into the controls. And I can see right here that they have a rate. This is their rate of 15, a tidal volume of 450. Their PEEP is at 10, and they're on 60% oxygen. And they're in SCMV mode. And now I want to check the alarms. The pressure alarms could be a little higher on the high pressure, and the low pressure should be set at 10. Below roughly. Apnea alarm is set correct. The rate is set correct. This could be a little bit higher. Expired minute volume is good. The ventilator graph looks good. The peak pressure here, expired minute volume, and their tidal volume, and the alarms are also set on here. I'm going to record all this in my chart along with the number and the type of vent, which is a Hamilton G5, the humidity, where the airway is situated. Is it on the lip or the nose, or the lip or the mouth, along with the breath sounds. If I did have to suction, how many times I suctioned, and if it was saline. I'm going to note other things like the mask and ambu bag at the head of the bed. And the bed is also 30 degrees. And then after I'm done charting, I'm going to reassure the patient everything is all right, and I'm good. Then I'm going to go chart everything and tell the doctor and the nurses my findings. and leave the room how I found it, but I'm going to discard my gloves, my hands, reassure the patient, have a good day, and that's it.